My name is Dr. John Krempecki, and here at Cape Fear Eye Associates, I'm the specialist in pediatrics and developmental vision. Today, we're going to be talking about amblyopia. What is amblyopia? Amblyopia is commonly known as a lazy eye. This is a misconception because the eye is not lazy. Rather, there is a weak signal connecting the eye to the brain. Think about a light bulb. Plugging in a lamp to the wall. You turn on the lamp switch, the light bulb turns on. In amblyopia, we're comparing two lamps, one to each other. Think about the light bulbs as the eyes, the lamp cord as the optic nerve, which is the cable that connects the eye to the brain, and the plugs plugging into the same wall socket, and the wall socket being the brain. In one light bulb or lamp, the light is brilliant, bright, and shining. In the other light bulb, the bulb flickers, it's dim, not quite as bright. This is amblyopia. Amblyopia occurs when we're unable to improve the vision in the absence of any diseases or pathology with glasses. There are three basic types of amblyopia. The first is due to prescription. A high amount of prescription in one eye and almost negligible prescription in the other, or a high amount of prescription in both eyes. Either case, the brain tends to favor one eye, leaving the weaker eye, just like the weaker light bulb, to not see as clearly. The second case is due to an eye turn misalignment of the eyes, or strabismus. When an eye turns, the brain does not receive equal signal, and the eye that is turned, the brain starts to ignore. This is called strabismic amblyopia. The last type is called deprivation amblyopia. This is due to a presence of diseases of the eyes, such as cataracts, such as nystagmus, or anything that causes the vision received by the eye, the signal sent back through the optic nerve to the brain, to not be as clear. Just to review, refractive amblyopia is due to a high difference in prescription between the two eyes. Strabismic amblyopia is due to an eye turn, and deprivation amblyopia is due to a presence of disease of the eye. Going back to our discussion about the two lamps of the light bulbs, if the light bulbs are not of equal strength, of equal power, the brain does not have the same input between the two eyes. The difficulty now is the brain is no longer using both eyes at the same time, and we have a problem with the ability to fuse the images. The images from one eye and the other eye needs to be fused together or put together so we are able to appreciate depth perception. Depth perception, as you may know, is the ability to judge visual spatial representations, important in playing sports, cutting with scissors, and driving. If we do not have depth perception, these tasks may be affected in our daily life, causing difficulties with our daily routine. How is amblyopia diagnosed? While a comprehensive eye exam is necessary to diagnose someone with amblyopia, it is not as simple as not being able to see the 20/20 line. Amblyopia occurs after we improve the vision with glasses. However, there still may be a weak eye. And when we have one weak eye or both eyes being weak, we have certain steps that we need to treat amblyopia. How is amblyopia treated? Amblyopia is treated first by correcting what we call the significant refractive error, or significant need for glasses, whether it's nearsightedness, farsightedness, or astigmatism. Once the vision is improved with glasses, we define or we identify a weak eye. If one eye is weak, then we start occlusion therapy or patching therapy. Patching therapy is done to cover the better seeing eye to force the weaker eye to work independent of the better seeing eye. Once patching therapy is begun, we typically return in 3 to 4 months to determine if the vision has improved. The type of patching and the length of patching will be discussed during the comprehensive eye exam and the follow-up progress evaluations for amblyopia. If patching therapy is not successful, or the child is resistant or reluctant to patch the better seeing eye, then we could try penalization with atropine drops in the better seeing eye. Atropine is a very strong dilating drop and will cause the vision to be quite poor in the better seeing eye, which will make the brain more dependent on the weaker seeing eye, hopefully improving the vision. In addition to patching and wearing glasses, the effective treatment for amblyopia is vision therapy. Vision therapy is the process of retraining the brain, strengthening the signal between the eye and the brain, so number one, the vision improves, and number two, the brain is able to use both eyes together to maintain fusion and to appreciate depth perception. Vision therapy is performed in the office and at home. and I will be happy to discuss vision therapy options during the comprehensive eye exam and subsequent progress evaluations for amblyopia. There is no surgical treatment for amblyopia. Surgery is reserved for misalignments of the eyes or strabismus. If you feel that your child, your neighbor, family relative, or a friend suffers from amblyopia, please schedule a consultation so we can discuss all treatment options, including vision therapy. As always, we at Cape Fear Eye Associates stand ready to help you with all of your visual needs.